help me spread prostate cancer awareness.
Count me in to raise awareness for prostate cancer.
We stress early detection. We're here as a team, and we're here to help men survive prostate cancer.
Hi, we're Innova. Count us in. We are the Andrew Jackson Masons. Count us in.
Count me in. Definitely count me in to promote awareness of prostate cancer.
Welcome back. Now, every 20 minutes, another American man dies from prostate cancer, and that's a little more than 75 deaths per day and 26,730 this year. That's enough to fill a baseball stadium. Welcome back. I'm Erin Hawksworth, and I figured since many of our viewers are men, this would be a great way to use our platform to raise some awareness tonight. So I want to introduce you to our guests. We have Dr. Nilay Gandhi from Potomac Urology. He trained at the prestigious Brady Urological Institute at Johns Hopkins Hospital, where he cultivated his skills with many pioneers in the field. And we also have Shawn Supers. She has a super name and has inspired many through her mission with zero prostate cancer. And she's really focused on engaging the community of men and families who are affected by prostate cancer in the Mid-Atlantic, one man at a time. Welcome to the show.
Thanks, Erin. It's great to be here.
Yeah, so I met you guys through an opportunity through work. I was asked to MC, or the opportunity came up to MC the Zero Run Walk. It was on Father's Day, and because my grandpa had prostate cancer twice, actually. I jumped on the opportunity because I have a personal connection with it, of course, and I'm just happy that we have this relationship now, and I'm looking forward to learning more about it and raising some awareness tonight. So, Dr. Gandhi, let's start with you. I mean, when it comes to Prostate Cancer Awareness Month, what's the main message that you'd like to get out there?
Yeah, the main message is that early detection can save lives. Men need to come out and actually get screened. That prostate cancer tends not to have any symptoms. And so it's one of those things that it involves an active person to come visit their doctor to just start that conversation to even investigate into prostate cancer. And
we were just talking before the show. I've told my dad, especially even after the Father's Day run walk, I called him like, please, go get your PSA levels tested. And I don't think he does. I don't know why. I think he has this thing about going to the doctor. I don't know if it's his pride or his manlyhood or what his deal is, but it's important. And he's my dad, and I don't want, I want him to be on top of this and not find out years later that it maybe, it's at a high level and it could have been treated earlier.
Right.
That's the thing that is so frustrating to me about prostate cancer, is that if it is caught in the early stages, it's 99% curable. So it's a shame that we're losing a man every 20 minutes to the disease. And I think the biggest thing that I find as a myth when I talk with groups is that men believe they would have physical symptoms that would let them know that they're having prostate cancer. And the sad truth is that by the time they are having physical symptoms, it's usually because the cancer has metastasized to other organs or to their bones. And that's when it becomes very, very deadly.
So what do you recommend then?
So typically, we recommend that between the age of 40 to 50, you should at least have a PSA done once. After the age of 50 is when you come in, you visit with the doctor, and you get a PSA, which is a blood test, and then a digital rectal exam. And that's the exam that most men fear and avoid going to the doctor for. But that allows us to kind of assess a trend with their PSA blood test to see if there's any abnormalities to make a determination if they're at higher risk for prostate cancer.
Okay, let's take a couple calls now because I want people to call in. Sarah in Woodbridge, you're up. What's up, Sarah?
Hi, I have a question for Dr. Gandhi.
Yes.
So my husband has been seeing his primary care. He's 55 and he's gone every year. Each year his PSA has gone up just a little bit. The primary care doesn't seem to be alarmed. When do I know when it's time to take him to see a urologist?
That's a good question.
That's an excellent question.
Yeah.
And I commend him for having the PSA done regularly, because that again allows us to see a trend. And like you said, it does increase a certain amount each year. There are certain parameters that we use to measure that if it goes up a certain amount, then that is concerning for how quickly that PSA is rising. But you know, there's always the opportunity that if you are concerned about it, to visit with a urologist to be able to investigate it further.
Now, along those lines, and that is a great question, Nationals manager Dusty Baker, he's had prostate cancer, and his father had prostate cancer, and I was reading that he was getting his levels checked all the time, just like Sarah's husband, and all of a sudden he noticed a trend like Dr. Gandhi's talking about. I mean, it would go up a little bit, but then it shot up, and I don't know if I'm saying this right, but like 2 points or what, you know, something like, it was different than what it was going up, and he thought, oh no, you know, and that's exactly sort of what she was describing, right, you know, in terms of seeing a trend.
Absolutely. You know, there's always, everyone hears kind of the trigger number is 4, that if it's above 4, you're at a higher risk, but that's very dependent on someone's age and then also these trends. So someone could have a PSA that's in the 1.5 to 2 range and all of a sudden jumps up to 3 or 3.5. It's a very quick rise. That could still be worrisome.
And why is it called 0? Tell us about that.
Well, frankly, it's called 0 for a couple of reasons. One, because your ideal PSA score should be 0 if you're healthy, right? The other reason that we're called 0 is because we're striving towards generation 0. We want to see a whole generation free of prostate cancer. And you know, research that we have been investing in and working towards for the last 5 years has really improved a lot. If you were diagnosed just 7 to 10 years ago, as I understand it, there was one drug or one treatment available for men. Now there are many options that are available, especially when the cancer's caught early. So I think, there's nothing to fear. We like to say, don't fear the finger, because there really isn't anything to fear, especially if it is caught early, because there are so many great treatment options that are available.
Yeah, and you're going to have a lot more to fear if you wait and don't get on top of this. And another thing, going back to Dusty Baker, we were talking about this before the show, and I mean, he just had so many great points about it that, women talk about breast cancer, but men don't seem to talk about prostate cancer. Why is that?
I think a lot of it has to just do with historical, I guess, reflections on seeing a doctor. There's kind of a sort of macho level to it as well, that I'm feeling fine, I don't need to go see a doctor, or everything is okay. We hear a lot from people who come in and say, I've never seen a doctor my whole life. That's not always a good thing. And so I think it just takes that, making sure that everything is healthy, that things are going well, for you to just continue knowing that there's not much to worry about.
All right. We got to take a break, but Jeremy in Indiana, he's watching online. I think we also have some other calls. If you have some questions for Dr. Gandhi, Shawn Supers of 0, please give us a call, 703-387-1020. We're talking about prostate cancer awareness. September is Prostate Cancer Awareness Month, so that's why we're talking about it on this show tonight, because 1 in 8 American men will be diagnosed with prostate cancer. We're back after this. Welcome back to Toyota Sports Talk. We're talking about prostate cancer awareness, as September is Prostate Cancer Awareness Month. We have some calls already. We're going to go to Jeremy in Indiana. He's been waiting. He's watching online, and he has a question or maybe some comments for Dr. Gandhi and Shawn. What's up, Jeremy?
Hey, I was just wondering, my father was diagnosed with cancer, but it wasn't prostate cancer, and I'm wondering if that puts me at a greater risk for prostate cancer if he's got, say, skin cancer, or if not, what would put me at a greater risk?
That's a good question. We were going to talk about the risks, so hey, perfect segue. Thank you, and great question. Thanks for watching online.
So the risks for prostate cancer tend to be associated with age, typically after the age of 50, with the most common risk factors being around the age of 55 to 69 years of age. And also African American, being African American can increase your risk, as well as having a family history. So those are main risk factors associated with having prostate cancer.
And then you were just telling me that the guidelines have changed, so you almost have to be an advocate for your own health, which is kind of scary, because so you basically have to ask for it then, because they're not necessarily going to be like, hey, you're 50, you need to get this done, right?
Correct.
Okay.
Yeah.
But it's as simple as just, when you go for your yearly exam, because everybody goes for their yearly exam, right? They're going to do a blood draw anyway. And so just ask them, gentlemen, ask your doctor to do a PSA test. They literally check a box on a form, and then you'll know your score. We all know the scores of the baseball games and the football games. We should know our PSA scores.
There you
too.
go. I like the sports tie-in there. Okay, this might be a stupid question, but then, like, if you're doing the blood test, the PSA test, when do you need the other exam, you know? Because do they need to be asking for that, or when does that come in?
Yeah, so that test should be done at least once a year. And it is, you know, like you said, patients actually do have to ask for that test at some point because, you know, to be an advocate for your own care, some primary care physicians won't do that test. If you see a urologist, you'll always get that test at least that first time because, again, it's another way we use to screen prostate cancer. You can actually detect very aggressive prostate cancer with a finger exam, and we've had many men who've had a normal PSA, and they've come and told us that their primary care doctor did the exam and found something abnormal, and honestly, that exam saved their life.
Okay.
Yeah.
All right. Let's go to Carrie in Arlington. Hey, Carrie.
Hey, how are you, Erin?
Good. Thanks for calling in.
Well, thank you, and also a shout out to the doctor and Miss Shawn. I just wanted to thank you for calling attention to this matter, since I think you've covered that prostate cancer is actually one of the leading causes of cancer deaths among men. But you all touched on this whole issue of men not wanting to, like, fuss about it. And so what I would maybe suggest, since you were kindly enough to call attention to this issue, is if men, as they like to do, don't make it about themselves, but make it about the broader picture. There's so many other types of cancer that are deadly. If they can show as role models, which sports figures are, that they're, you know, looking into prostate cancer, and they encourage other people to look into other types of cancer, which I unfortunately have seen in my family, then I think that would be very well appreciated, and that would be such a good thing.
Yeah, that's a great point, and I really appreciate your call and for sharing what you shared. I think that is a very, very good point. We have to take a break. When we come back, we have more. We're going to continue the conversation here on Toyota Sports Talk right after this. Welcome back. We only have about a minute left in show, but you guys have a very special event coming up. Tell us a little bit about that.
Yeah, so this is a tee-off against prostate cancer at Topgolf in Alexandria next Thursday, September 28th from 6 to 9 o'clock. A 5-person team is just $250, and it benefits zero in our programs. It includes 3 hours of Topgolf play and food and drink. We've got some nice swag bags for our participants, and if you want to register, you can go to our website, zerocancer.org. /tee-off Alexandria, and I think it's right there on the screen for everybody to be able to see.
And as Dr. Gandhi was saying, it really ties in all things that men love, right?
Yeah, I think it's a great combination of, you know, sports, beer, and raising awareness for prostate cancer.
I love it.
Absolutely.
And also go to the website. Can you give it to us one more time?
Yes, yeah, zerocancer.org. There's a great deal of information on there, from Zero Hero survivor profiles to advocacy alerts
Sorry,
and more.
I'm gonna cut you off. Thank you. Go there if you have more questions.